Welcome to Advanced Dual Health and Life Coach Certification. Today we're going to discuss exploring therapies and techniques, specifically somatic experiencing and body awareness in coaching. Let's start with an introduction. Somatic experiencing, or SE, and body awareness represents cutting-edge methodologies in coaching, offering profound ways to harness the body and mind connection to facilitate growth, healing, and transformation. Unlike traditional coaching models that often prioritize cognitive processing or emotional analysis, SE focuses on the body as a critical site of knowledge, resilience, and healing. It operates on the premise that the body holds on to experiences, especially stress or trauma, and working directly with bodily sensations, individuals can create lasting change beyond traditional talk-based approaches. Let's review some key points of learning. Number 1, the science behind somatic experiencing. SE is rooted in the biology of the nervous system, particularly in how it processes trauma and stress. It was developed by Dr. Peter Levine, who observed how animals in the wild naturally release stress to avoid long-term trauma effects. Humans, however, often lose this self-regulation due to societal conditioning or suppression of instinctive responses. Trauma and the nervous system. Trauma occurs when an event overwhelms the system's ability to cope, leaving trapped energy in the body. Common reactions include flight, fight, or freeze responses, and SE works to complete these incomplete stress responses. For example, a client who experiences heightened anxiety may have unresolved fight or flight response stored in their body. SE helps them access and release this pent-up energy. Application and coaching. Train clients to notice when their body feels frozen or activated. For example, where in your body do you feel tension right now, and how does it feel, and what is it like to expand or polyvagal theory connection. The vagus nerve, a central part of the autonomic nervous system, governs our stress response of safety. Polyvagal theory distinguishes 3 states. Ventral vagal, or social engagement, safe, calm, connected. Sympathetic, fight or flight, alert or anxious. Or dorsal vagal, freeze, collapse, shut down, or numb. SE helps clients move out of the survival states, sympathetic or dorsal, and return to ventral vagal regulation. Coaching exercise. Explore ventral vagal recovery through ground practices like breathing and focusing on orienting the gaze around the room to create safety. The pendulation process. Pendulation refers to gently moving between sensations of discomfort and safety. By exploring sensations in increments, clients gradually expand their capacity to handle discomfort without feeling overwhelmed. For example, a client notices a knot in their stomach while discussing a challenge. Instead of suppressing it, they are guided to alternate between feeling the knot and sensing a safe part of the body like the hands or your feet. Body awareness is a tool for insight and change. Body awareness is a practice of directing non-judgmental attention to physical sensations, uncovering hidden patterns of stress, behavior, or emotion stored in the body. For life and health coaches, body awareness is especially powerful in helping clients understand how their physical state impacts their emotions and capacity to cope. Connecting physical sensations with emotional states. Body awareness emphasizes that emotions often manifest first as physical sensations before they are consciously understood. For example, clients might clench their jaw during stress or hunch their shoulders in fear. Creating awareness of these patterns can help identify blind spots in their emotional landscape. The coaching practice. Ask open-ended questions like, what do you notice in your body when you think about X? Understanding interoception. Interoception refers to the body's ability to sense its internal state, such as hunger, thirst, or tension. Cultivating introspective awareness helps clients develop a deeper relationship with their body cues. An example exercise. Guide clients through a body scan, asking them to observe areas of warmth, cold, tension, or lightness. And mindful movement. Movement practices such as yoga, tai chi, or somatic exercises help release chronic tension and reconnect clients with their body in real time. The coaching example. Encourage clients to explore their body through simple gestures like stretching or walking and reflecting on how these movements affect their emotional state. Number 3, core principles of somatic experiencing and body awareness in coaching. Safety first. The human nervous system cannot heal in a perceived state of threat. Creating a safe, supportive coaching environment is crucial. Establish verbal and nonverbal cues that communicate empathy and safety. Phrases like take your time, I'm here, can help ground the client. The body is a resource. SE emphasizes that the body is not only a source of stored trauma, but also a resource for healing and resilience. By accessing positive sensations such as warmth or strength, Clients can anchor themselves in safety. Here's an exercise. Ask the clients to recall a memory of feeling calm, safe, or strong. Where do they feel it in their body? Visible and invisible trauma responses. Trauma may manifest as psychological symptoms like shallow breathing, rapid heart rate, or chronics, and even the conscious emotional signs. Learning to spot these cues is essential, and it's a skill for coaches. Number 4, tailoring somatic approaches for life and health coaching. Life coaching context. For stress management, teach clients grounding exercises during movements of overwhelm. For career transitions, use body awareness to identify physical reactions to potential choices. Example question to explore connections between body and career decisions might be like, what shifts do you notice about your body when you imagine taking that job? Health coaching context, health coaching models. For weight loss or fitness goals, unearth emotional drivers or behaviors like tense body states tied to eating habits, and explore how chronic stress responses like cortisol dysregulation impact your health goals. Number 5, practices for coaches to implement SE and body awareness. Grounding exercises. Help clients connect with their environment to reduce activation. An example dialogue. Feel your feet pressing into the ground. How do your legs feel when you stand? Steady or shaky? Orienting practices. Direct a client's attention outward to restore a sense of safety. Have them name 5 objects or colors in the room during stress moments. Somatic tracking. Track recurring bodily sensations and their shifts, deepening insights into patterns. Breathwork guidance. Teach clients to use breath to regulate their nervous system gently, noticing shallow versus deep breathing patterns and practicing slow exhalations. Safe exploration of sensations. Support clients by encouraging them to explore their sensations without rushing. Use clues like stay with that feeling just 10% longer and see if it changes. Take a second to review this diagram on the right. Grounding and establishing safety. Can you place your feet firmly on the ground and notice how they feel against the floor? Is it cool or neutral? Take a slow breath in and out. Now look around the room and name 3 objects you see. How does your body feel as you do this? And what does safety feel like in your body right now? Is there a part of you where you notice steadiness or calmness? Exploring body awareness. When you think about the challenge you're facing, what happens in your body? Do you feel tightness, warmth, or something else? What happens to your shoulders or your jaw when you speak about the stressor? Does anything change if you gently roll your shoulders back or unclench your jaw? I notice your hands are fidgeting. Is there something you want to do with your hands or your body might be trying to tell you? Take a few moments to review this diagram of safety first on the right. Facilitating emotional release. If you could give your tight chest a voice, what would it want to say? Or is there a gesture that expresses it? Sometimes our bodies hold on to emotions like tensions. What do you feel would happen if you moved your arms like this and maybe demonstrate flowing your arms? Imagine carrying this emotion if it were in your body as a weight. If it could shift in size or location, what might happen? Empowering introspection, internal sensing. What does your breath feel like right now? Is it deep, shallow, smooth, or irregular? Let's pause for a moment and tune into your heartbeat. Does it feel rapid or steady? What is it trying to tell you? Place your hand on your stomach. Can you feel the rise and fall of each breath through your midsection? Navigating entrapped energy or trauma responses. It sounds like you're feeling stuck. Can you find a single point in your body where tension feels lighter or easier? Let's focus there for a moment. And is it okay if we take this at a slow pace? You can pause and notice any sensation or shifts that might come up that we can speak about. Aligning body awareness with values and goals. What do you notice in your body when you talk about these goals? Does leaning into them feel expansive or restricted? Try envisioning the decision you're hesitant about. Does one choice make your body feel more grounded or congruent with your values? When you imagine stepping into that career, what shifts in your posture or breath? These quotes serve as practical conversation guides to bring somatic principles directly into the coaching process. Best practices for coaches. Effectively incorporate somatic experience and body awareness into coaching requires a thoughtful, structured approach. Below are actionable best practices to ensure a safe and empowering experience for clients. And establish psychological safety. Begin every session by creating an environment of trust, safety, and collaboration. Use nonverbals and verbal cues such as maintaining a calm tone of voice, gentle eye contact, and positive affirmations of the client's efforts. For example, start with grounding exercises to provide stability. Number 2, be client-centered and non-directive. Allow space for clients to explore their sensations, emotions, and stories without judgment or imposing interpretations. Respect the client's rhythm. Body-focused work often progresses in small incremental steps. And avoid fixing reactions or forcing clients to confront difficult situations before they're ready. Practice pendulation, alternating between comfort and discomfort. Avoid overwhelming the client by revisiting the sensations of discomfort for limited periods of time and then anchoring back to sensations of safety or ease. Teach them to oscillate between areas of discomfort and calmer body zones until the nervous system adjusts to distress more fluidly. And number 4, incorporate grounding techniques repeatedly. Grounding restores a sense of presence and safety when clients are emotionally or physically dysregulated. Techniques include foot pressuring, deep breathing, oriented visual focuses, or tactile sensing. Grounding is particularly effective in mitigating heightened activation during trauma-focused discussions. Number 5, tailor practices to the individual needs. Each client will engage with somatic work differently based on personality, past trauma, and body awareness. Work collaboratively to find safe and effective practices for each client's needs. Discuss options openly, adapt exercises based on real-time feedback. In other words, clients who are uncomfortable with touch might prefer visualization exercises instead. Master the subtle cues of somatic responses. Develop keen observational skills to notice signs of stress or regulation. Watch for subtle cues like changes in breathing, muscle tension, swallow, or posture. Validate and normalize client experiences using phrases like, "It makes sense that your shoulders feel heavy when recalling such a difficult moment." And integrate breathwork exercises. Guide clients in exploring their natural breath patterns such as inhalation, depth, exhale length, or pauses between breaths. Teach techniques like box breathing, equal counts for inhaling, holding, exhaling, and holding to steady nervous system reactivity. Take a moment to review the somatic nervous system diagram on the right. Number 8, use movement to dislodge chronic tension. Encourage clients to engage in movement exercises explicitly tied to physical release, such as light stretching, shaking off tension, or swaying. Movement can reflect emotions. Client expressing frustration, for instance, could clench first and then open them slowly, completing a tension release cycle. Number 9, commit to self-care as a coach. When facilitating somatic work, it's important to maintain your own psychological routine. Regularly practice grounding exercises for yourself to avoid absorbing a client's tension. Taking a few breaths slowly before each coaching session can prepare you to hold a calm space for your client. And number 10, encourage integration beyond the sessions. Suggest that clients practice body awareness techniques in daily routines. Examples include checking in with their breath during a stressful meeting or releasing shoulder tension while cooking. Recommend journaling about physical states or creating a personal body scan ritual to deepen introspective awareness. Number 11, provide gentle education on somatic insights. Help clients understand the science between somatic experiences in accessible terms, such as how trauma impacts the nervous system or how the vagus nerve supports stress management. Example for explaining pendulation. It's like dipping a toe into a cold pool. You'll feel the sensation briefly and then step back into the warmth. Practice compassion and patience. Somatic work often takes time as clients learn to trust their bodies and build emotional regulation skills. Celebrate small wins, such as noticing tension or completing a deep breath. Here are some summary tables for your review. Table 1. The science behind somatic experiencing, or SE. Take a few moments to review each aspect: trauma in the nervous system, polyvagal theory, pendulation, trapped energy release, and biological insights. Table 2. Body awareness is a tool for insight and change. On this slide, you'll see the aspect, the explanation, the examples, the purpose for clients, and the coaching practice. Take a few moments to review each aspect: physical energy link, interception, mindful movement, tension habit patterns, and emotional release. Table 3, core principles of somatic experiencing and body awareness. Here you'll see the principle, the definition, why it matters, examples and coaching, and tips for application. Take a few moments to review each principle of safety first, body as a resource, expanding capacity, subtle signal awarenesses, and non-judgmental observation. Table 4, tailoring somatic approaches for different coaching contexts. Here you'll see the coaching type, the challenge addressed, the somatic approach used, the outcome for clients, and the example question and example. Take a few moments to review each coaching type: life coaching, stress management, health coaching, trauma healing coaching, and goal setting coaching are just some examples on this table. Table 5, practices for coaches using SE and body awareness. Here you'll see the practice, the description, how it benefits clients, the example use case, and implementation tips. Take a few moments to review each practice. We have grounding exercises, orienting practices, somatic tracking, breath work, and movement decompression. Here are some multiple choice questions to review what you've learned. Question 1. Which of the following best describes the concept of pendulation in somatic experiencing? The correct answer is B. Question 2. What is the primary purpose of grounding techniques in somatic experiencing? Review options A through D. The correct answer is B. Question 3. Which of the following best exemplifies body awareness in coaching? The correct answer is C. A client notices tightness in their chest while discussing a stressful situation. Question 4. What is one of the first priorities when introducing somatic techniques in coaching sessions? The correct answer is B. Creating a safe, non-judgmental environment for exploration. Question 5. Which of the following quotes is an example of utilizing body awareness in a coaching session? The correct answer is B. Where in your body do you notice tensions when you think about this challenge?